right, welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Safina Adatia. She's an addiction medicine physician. Today's Kevin MD article is Why Gambling Addiction is America's Next Health Crisis. Safina, welcome to the show.
Thank you very much for having me.
All right, so let's briefly share your story and talk about this Kevin MD article that you wrote for us today.
Yeah, so my name's Safina. I'm originally from Canada. I trained at McGill University. I did family medicine, and then I came to Boston for an addiction medicine fellowship. And it was something that was a passion of mine. And now I work as an addiction doctor. And something that I noticed just being in Boston, which is such a sports-centered city, is sports betting ads are literally everywhere. They're so pervasive. And my partner, my fiance, who is a Boston native, I asked him about, he's a big sports fan. And he was like, yeah, betting apps and ads and everything is just so pervasive. And I was like, we have to talk about this, because even in my fellowship, behavioral addictions, I mean, we learn a lot about addictions for substances like alcohol, for opioids, for, cocaine, stimulants and things like that. But behavioral addictions like gambling is not something that's as much covered. And so I think it's just going to become such a pervasive issue. And I really wanted to look into it. And lo and behold, I was right. And so this article came to be basically from that standpoint.
All right, so let's start with the Supreme Court's 2018 ruling that kind of set what you said, this runaway train of motion. So talk about that decision and what did that start?
So that decision basically opened up sports betting as legal. And I mean, each individual state has determined its own laws around whether you can bet online, in person, and things like that. So about 39 states, is my understanding, have sports betting as legal. The states vary on who can go in person and who can do it online, but it's not hard to get around the rules for betting online. And so it's just become what was a $100 million industry or $400 million industry has now become multi-billion-dollar industry. And it's just everywhere. And the ads are everywhere. And it's just really become problematic, especially amongst the youth, I would say.
And I definitely second that. I listen to a lot of sports talk radio. I listen to a lot of sports podcasts, and almost every other ad is some type of sports gambling site. And it's just as easy as downloading an app, and it's very, very frictionless.
Totally. And they also they know it's so addictive that they incentivize you. They're like, bet this and you'll get a bonus, or join and you'll get $25 to bet. And there's just so many ways to get hooked on it. And there's no one monitoring at all. If you can put in fake IDs, no one's really checking. It's an industry that is just catapulted with very little regulation.
So talk to us more about the dangers of gambling addiction and perhaps contrast that with the other forms of addiction that physicians are familiar with.
Sure. I mean, addiction in general, the pathways that are lightened up in your brain, the dopamine pathway is all kind of the same mechanism that happens for alcohol addiction, for opioid addiction. The feeling of the high is all very similar. The consequences for gambling addiction, I would say, are just slightly different, because it's money. You're spending a ton of money that oftentimes people don't have. So you can get foreclosures on your homes. Again, it affects men right now more than women, just because men tend to be the target demographic for sports betting in general, just because they're the target audience for sports. But we've seen an increase in women sports bettors as well. About a third of the market now is women. And so in terms of the consequences of betting money, because it's so addictive, people are obviously have such financial catastrophes that can happen, losing their homes, losing their relationships. Suicide rates are quite high and associated with gambling as well. And we see that with generalized addiction as well. However, gambling tends to affect anyone of any financial demographic, just because you have the means to spend money. Whereas I find things like opioid use disorder, stimulant use disorder, you have more housing insecurity, environment, genetics, all of these things can play a little bit differently. Whereas I find with gambling, it really does not discriminate against your financial background and SES and things like that.
And how does gambling addiction present when you see patients in your addiction medicine clinic? Like what's a typical picture of someone with gambling addiction? How would they come to the clinic?
To be honest, we don't see a lot of people presenting with gambling addiction. That's the main thing. A lot of people don't recognize that they have a problem. Whereas with substance use addiction, it's just so much more pervasive, where it's recognized as a problem because the Supreme Court ruling is quite recent. Whereas like alcohol, cigarettes, that was in the 60s. And now we have kind of finally recognize that those substances are not healthy. And even then, with alcohol, for example, it's quite slow. It's only just starting to be recognized as a dangerous substance. But if you think about the ads for smoking back in the 60s and how it was like encouraged to smoke at all these, Fenway Park, my partner was saying, like, the ads are just for smoking, were everywhere. And now, 60 years later, we're able to say we finally cut down on cigarette smoking. Gambling is so new, right? Like gambling's been around forever,
Hmm.
but the online gambling component is just so, so new that I don't think people realize that they have problems with gambling as of yet. And so I don't actually have a lot of patients who present in the clinic. In my mind, it's someone between the age of 25 to 34. That's like the most common age group we see. And it's a young male, who's into sports. And people don't necessarily think they have a problem because they're betting sometimes small amounts and they don't realize how how bad it can get, to be honest. And so I don't think we're going to see people presenting in hospitals or clinics for some time.
Now, whenever I listen to those sports betting ads, at the end, there's always a 1-800 number, some type of
Mm-hmm.
hotline. If you have a gambling problem, call this number. Now, do people actually call those numbers? Like, what happens when you do call those numbers? How effective are they?
To be honest, I haven't actually ever tried, so I'm not 100% sure, but I don't think it's enough, right? A 1-800 number. I mean, there are crisis lines. It's mandatory for them to provide
Yeah.
some type of help and assistance. And I'm sure the lines, can direct them to services that are in person, but there hasn't been, in terms of treatment for gambling use disorder, there isn't a ton out there. I mean, we have some medications, but it's really cognitive behavioral therapy, a multimodal avenue of medication, therapy, counseling, and trying to break this pattern and cycle that takes months. It's not going to be just calling a helpline one time that's going to help someone out of their addiction. It's going to take time, and we actually need significantly more research because it's just become such a widespread issue now.
So how does one screen for a gambling disorder, say in the primary care setting that I'm familiar with? What kind of questions should I be thinking, or what kind of history should I be on the lookout for if someone potentially has a gambling issue?
That's a great question. There are some questionnaires that exist, and oftentimes it's about how much are you gambling in terms of the day to day. Are you doing this every day? Are you doing this a few times a week? Are you hiding it? Hiding is a big
Mm.
component of screening for gambling use disorder. Is, are you hiding this from someone? Similar to other substances, you can even use the DSM criteria, to be honest, and just replace the alcohol with the gambling. Like, how much money are you spending on this? Is this affecting your relationships with people? Are people thinking that, you do have a problem with this? And so I would say the combination of, it's not a normal question to ask, like, is gambling a problem for you? It's
Hmm.
going to be something that probably comes up in the context of that person initiating it. But once they do initiate it, I would say asking similar questions to other substances, replacing it with gambling. And then there are gambling specific questionnaires that you can access.
So let's say I ask some of these questions and I have a suspicion that that patient in front of me
Mm-hmm.
has a gambling issue. So
Yeah.
in terms of next steps, like what are some resources? You mentioned things like cognitive behavioral therapy, potentially some medications. So from a primary
Yeah.
care setting, where would I direct that patient to?
You can always direct them to an addiction medicine physician or psychiatrist. I think that's like a really good resource to start off with. In terms of the other types of treatments, SSRIs, so things like sertraline, have been somewhat studied with a little bit of effect. Naltrexone is another one. And then brand new GLP-1s are kind of like
Mm.
Ozempic and Wegovy are really coming up in front in terms of treating all kinds of addictions. So I think experimenting just because something and trialing something is probably better than nothing to help someone. And if the side effects or the benefits outweigh the risks, then trying some of those medications to start and then referring them to an addiction specialist would probably be the next steps, is my thoughts.
And first line, let's say the contrast between naltrexone, which I know is used for alcohol use disorder, and SSRIs in the primary care setting, is there a particular one that you would lean towards first?
I would say naltrexone probably, just because it's been demonstrated to have efficacy in alcohol use disorder. And what it does is it blocks the endogenous opioid pathway when it's activated, when you have the euphoria, which targets essentially the dopamine pathway. Whether it's going to be effective or not, we don't really know. But again, these are such new issues and concerns that the studies are just not 100% there yet. We just don't have the research to say whether this will work or not. But I would start probably with naltrexone. You could do a combination of naltrexone and an antidepressant, especially if the person also has comorbid depression, anxiety, which again, with gambling, you often have comorbid mental health issues. So
Hmm.
there's nothing to say that you couldn't try both together, to be honest, while you're waiting to refer to therapy or things like that.
Have you seen or heard a success story where someone may have been diagnosed with a gambling addiction or gambling use disorder, and there was successful treatment in turning that around? Have you seen or heard a success story that you could share with us?
Personally, no, not yet. Because as I said, we just don't have the data or the numbers yet of people who I think are presenting in clinics with gambling use disorder. I think if you were to have, you know, more psychiatry focused, just because again, there's more an abstinence based therapy that comes with psychiatry versus in the primary care setting or addiction medicine physicians versus addiction psychiatry. I think that would be a different outcome. But for me personally, I haven't treated very many people with gambling disorder just because of the fact that it's still so new. I also think the demographic who has a gambling use disorder, like the young male clientele, they're not going to the doctor in general. They're not
Hmm.
accessing services in general. And so I think it's going to be another 5 to 10 years before we see this as like a serious, serious problem.
How about from a policy standpoint? In your piece, you draw parallels to tobacco companies and the regulations that have been placed around them. So, from a
Mhm.
policy standpoint, do you see any movement, or what would you like to see done?
Oh my gosh, the marketing. There needs to be more restrictions on the ads. There was a study that I just read about that when you have access, when the ads are there, it really promotes the person to want to take action.
Yeah.
I mean, we know that from anything from buying beauty products to TikTok, like anything where you're advertising something, it's going to have an effect on the person. So if they have control on the ads, like they do with the pharma industry, if there's control on what is advertised, that can really change the trajectory of these things. Because again, when it's being promoted so heavily, you walk through North Station in at the TD Garden, and it's just billboard, billboard,
Hmm.
billboard, billboard. It is insane, like the advertising. And again, like you said, every other advertisement that you hear on the radio, on you know, and now that we have AI and on social media, you can see that the ads are going to start targeting certain demographics who are more
Hmm.
susceptible, more prone, who are watching, and it's just going to become this cycle. So there needs to be control on the ads. I also think there needs to be more diligence with checking ages and IDs, especially with the online sports betting, because it's very easy to skirt around the rules. And so there just needs to be more restrictions on who can sports gamble and how people are able to apply for an account, and just ensuring that the youth and the adolescents who are just so much more impressionable or do not have access.
And as far as you know, are you seeing any movement on the federal or state level regarding any types of these regulations you're talking about?
I think there's talk. I don't think it's happening yet, just because the lobby is so big of
Hmm.
sports betting, and it's again like it's like an $11 billion industry now as of 2024. It's huge. So I think it's going to take a little bit of time before we see actual progress, and I think it's gonna things might have to get more dire before rules are reversed.
All right, let's take a step back and maybe talk outside of sports gambling. So you did mention things like GLP-1 agonists in the treatment
Mhm.
of potential addiction, and I'm seeing that in the news as well. So where are we with that? What kind of potential are we talking about, and what kind of data do we have so far regarding that?
It's still very early stage, so it's still very much experimental. I think obviously it still needs to be a very target clientele because it does result in weight loss, whether we like it or not, like in a candidate. So you need to pick someone who, may have weight loss as a goal as well as
Mhm.
a substance use disorder. And I think that it's probably one of the most promising things we have in addiction because it really does quiet the noise in the brain. That's what everyone says when it comes to food. And it's what's happening with addiction as well. And we have heard from patients in these studies that when they started cutting down on the food, they didn't have the desire to drink alcohol as much, or they didn't have the desire to smoke cigarettes. And so I think that targeted therapy, I think could have some serious widespread potential to treat substance use disorder. And I'm so excited to see what happens.
We're talking to Safina Adatia. She's an addiction medicine physician. Today's Kevin MD article is Why Gambling Addiction is America's Next Health Crisis. Safina, let's end with some take home messages that you want to leave with the Kevin MD audience.
First of all, I want people to say that addiction can affect anyone. This is not something that is specific to people who are unhoused, who don't have financial means. I think addiction is anyone is susceptible. If you have an issue with addiction in general, please go see a physician. Physicians are trained in this. They can get you resources and help. There are lots of resources available within your state, within your country, online. But I think the main thing to note, especially also for healthcare providers, is that this is something that is pervasive. Addiction affects so many people across and almost 1 in 5 people use substances in general. And then more than that, people are getting addicted. And I think that it's really important to try to intervene when things are fresh and things are just starting out, as opposed to waiting until things have become very dire. So that would be my one thing. Also, screening is obviously very important as a healthcare provider. Asking about substance use and addiction, and adding gambling to that is so important, just because of the fact that it's become so pervasive in the last 5-7 years, and it's just everywhere, that gambling really is affecting a lot of people now, and we need to be more mindful of that.
Safina, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you for having me.